Almost 7,600 people with coronavirus checked into hospitals in Alabama since the pandemic began. The latest data from the State Department of Public Health shows a record 1,362 on Tuesday. It's putting pressure on hospitals everywhere, including here in North Alabama. WAAY 31's Sydney Martin talked to Huntsville Hospital CEO David Spillers about how the rising case numbers could impact the supply of personal protective equipment and how the hospital prepared. Sydney?
Huntsville Hospital CEO David Spillers told me the hospital stocked up at the beginning of the coronavirus pandemic on personal protective equipment, but said if cases don't get under control, it could put a strain on the supply the hospital has.
Yeah, we're going through a lot of PPE. We anticipated we were going to be in this pandemic for a long time, so we've stocked up on PPE as best we could.
Huntsville Hospital CEO David Spillers said it takes about 10 times more personal protective equipment for hospital staff to treat a coronavirus patient than a non-COVID-19 patient. And with the number of cases not only rising rapidly in Alabama, but across the country, they're watching their supply.
Nationwide, if this explosion of cases nationwide continues, at some point, there will be limitations on the ability of the people who are supplying all of the hospitals across the country to give us all what we need.
Spillers told me the hospital, like many other businesses, placed orders for masks early on from multiple vendors because it was unclear if the orders would be fulfilled.
We had the opportunity early on to get in 95 masks and protective equipment. We probably did over by then because we had no clue whether a vendor was going to be able to deliver, so we would buy from 2 vendors and both of them delivered.
With the unknown of what would happen when the state reopened, Spillers said keeping the supplies was not a question.
We just kept it all and put it in a warehouse. So we were able to put some in the warehouse. And then over time, the vendors have been able to give us more because they've all increased production.
Now, Spillers said if cases keep going up and the hospital can't and the suppliers cannot keep up with the demand from hospitals, he said the hospital will then be forced to dip into their warehouse supply while they work to buy more personal protective equipment. Live in Huntsville, Sydney Martin, WAAY 31 News.